All right, hey everyone, and welcome to KFVS Streaming. We're calling this Convos with Cunningham.
Oh, nice. That's
Yeah,
good.
this is Dr. Brent Keller with with Mercy Health. And last time you were here, we didn't have a name, so
That's right. That's good.
you get to enjoy.
I like it.
You get to enjoy this cool name that it took us forever to come
Convos
up
with
with.
Cunningham.
Convos with Cunningham. Yeah.
That's good. Did
So-
you come up with that?
Well, yeah, with some help from some other people. We had a whole list of stuff, and
I got you.
some was better than others.
Yeah,
But
I like it. I like it.
this is for the future. But anyway, thanks for coming in again.
Absolutely. Thanks for having me.
We're going to talk to Dr. Keller today about something that stuck with me because last time we talked, you said fatty liver disease, and you called it an epidemic.
Mm-hmm.
And so I thought, and you thought it would be a good one to talk about. But before we get into that, I want to do just kind of a recap from the last time we talked, which was about colon cancer and how it's affecting younger people
Right.
earlier. And so, whereas before your recommended first colonoscopy was age 50, now they have moved it up to 45. So tell us about that again.
Right. So over the last several 20, 30 years, we've seen that people younger and younger are getting colon cancer, and we think it's due to our diet and kind of environmental issues, but meaning our diet and what we're putting in our body. So they decrease it from 50 to 45 to try to catch that population of patients. And we're trying to find not colon cancer, but colon polyps, right? So that which is like little moles in the colon that develop into cancer. So if we get those polyps, we get people younger, get their colonoscopy, we can get those polyps out before it turns into cancer. We were finding upper 40s, low 50s people were getting colon cancer, and so that's the reason we moved it down. So if anybody's having symptoms like bleeding, unexplained weight loss, or they have a family history, they certainly need to check with their provider about what their timing is, because it could be younger than 45 if they have those risk factors. And if you're having bleeding, then you should get a colonoscopy at that point too.
And you said that, and I know again we talked about this previously, but you said our diets. We're talking about what, fast food, processed foods,
Yeah,
all the above.
all that. Yeah, so highly processed foods is linked to, and obesity is linked to increased risk in colon cancer. Yeah.
What is it about the foods and or someone who might be overweight that corresponds to these polyps and what could be cancerous?
So all the additives, like the carbohydrates that are being added, like maltodextrin is one of them. These things can get broken down in our body, and we metabolize them differently. It can be worse than actually sugar. It creates obesity, and which it creates an inflammatory environment, which creates polyps and then colon cancer. So the list, I mean, we could do a whole podcast. We can do another podcast on diet.
Hey, I'm open.
But it is all the high fructose corn syrup and all the things that are added to our foods that we're starting to focus on, I feel like, and trying to get that removed. But those things create a pro-inflammatory environment, which can lead yourself to all different kinds of cancer, not just colon cancer. But encourage people to read the label, try to eat whole foods and fresh foods as best they can. But that's what the thought process, at least.
You also mentioned alcohol as a contributing factor for colon cancer.
Right. So it just creates a same scenario, a pro-inflammatory environment, and try to minimize alcohol. We'll talk about it a little bit today with fatty liver disease as well.
So let's do that. When we talked last time, we talked specifically about colon cancer and younger folks being affected, and you mentioned fatty liver disease, and again, you called it an epidemic. So tell me what you meant.
Yeah, so about 100 million Americans have fat infiltration in their liver, and about 80% of those people don't know they have it. So it's a silent epidemic. Like, you don't realize you have fat in the liver, and it's important because with fat in the liver, it creates inflammation or irritation. So we use the rule of 20s when we're talking about fatty liver disease. And so of that 100 million Americans, 20% of those will develop elevated liver enzymes due to the fat in their liver. And then 20% of those people will turn into cirrhosis, which is hardening of the liver, just like if you're an alcoholic. 20% of those people with cirrhosis will end up having liver failure within 2 years of the diagnosis and needing a transplant. So I mean, it can progress rather quickly, but also it can be over time, just long-term elevation of liver enzymes, which is an inflammatory environment for the liver. But it is an epidemic because of the sheer number of people that have it, and then it's a silent epidemic because people don't know they have.
So I feel like, we talk about colon cancer a lot. We talk about heart disease. We talk about all things. I don't know that I've ever spoken to anyone about fatty liver disease. Is this kind of a new phenomenon?
It is becoming a hotter topic because we've had several years of obesity. It parallels the obesity epidemic. So it's not necessarily new in that sense, but at the same time, we are seeing it happening in younger people. Even our kids are involved, and this is all because of our diet, basically. And so it is not new, but it is becoming an issue because people are going into liver failure and with long time fat infiltration of their liver. And now we have, thankfully, it's not all doom and gloom. We do have the ability to catch this early with something called FibroScan, which we have at Mercy Southeast. We're the only people in the region that have it, but it is similar to an ultrasound in the sense that it's a probe, and you come in the office. It takes 10 minutes to do.
Who are people? I'm sorry to interrupt you.
Yeah.
Who are people who would be candidates for that? I mean, you said people don't know they have it.
Right.
So what would make someone decide? Well, maybe I need to go get scanned. I mean, what's your suggestion?
So risk factors of it is obesity, type 2 diabetes, high cholesterol. All the metabolic drivers that we have. And so that'd be somebody that would say, hey, we need to get a FibroScan. Somebody with elevated liver enzymes. That you go to get your checkup and they have elevated liver enzymes, don't know why. That'd be somebody that would need to get scanned as well. So I would say obesity, if you have high cholesterol, high blood pressure. But there's a large percentage of people that aren't overweight that still have fat infiltration in the liver.
Do you ever get symptoms? You know what I mean? Like, is it too late by the time you get symptoms for something?
You don't ever get symptoms.
You just, the only thing is this test that tells you've got fat in your liver.
Yeah, well, elevated liver enzymes in
Yeah.
a certain portion of the patient population will kind of tip you off. And there's a pattern. The enzymes are AST and ALT. And so we can see this. And this is used to how we had to do it. If you look, okay, they got elevation of liver enzymes, let's get an ultrasound, which would require about 30% of your liver to be affected with fat before you could pick it up. So you could have like 15 or 10% of your liver, and the ultrasound wouldn't pick it up. But this goes down to 5%, this FibroScan, so it's much more sensitive than ultrasound. But we would have to look at the liver enzymes, and once they became elevated, then we'd say, okay, you need to get an ultrasound or a CAT scan or something.
So you said, 20% will have the elevated enzymes, 20% of them will get cirrhosis. Are there no symptoms of when someone gets cirrhosis either?
So,
I mean, when it's progressed that
right.
far?
So when it comes out of what we would say, fatty liver disease into cirrhosis, yes, you can get symptoms in. Abdominal swelling, lower extremity swelling, sometimes you can get blood in your stool, confusion. These things that's decompensation of the cirrhosis, and that's when we get down to that transplant time. Like we're way down the road there, and we're trying to keep it at bay. So detecting early is the key. But in 2030, the prediction is the #1 cause of liver transplant in our country will be fatty liver disease. That's 4 years from now. So it's a real thing, and if we can get a diagnosis early, we can make changes. It changes our diet, changes to our lifestyle.
What about, I mean, again, I know that's extreme, and I'm not encouraging anyone to obviously wait to the point of needing a transplant, but I mean, not everyone that needs a transplant gets a transplant, right? Or do I have that? You may not know this.
No, it's true. That's true. I will say that, so let's say you have cirrhosis due to chronic alcohol use, and you haven't stopped drinking. So those folks don't get transplanted typically, because they get a new liver and think they'll hurt that liver. So, but people with fatty liver disease, there's a high percentage of those folks that qualify, and mainly because they're getting it at a younger age, in their 60s, 50s, and they're otherwise healthy, and they're not chronically drinking or whatever. But drinking with fatty liver disease, I guess I should say that, if you have fatty liver disease and you drink, even a moderate amount, which they just changed what that means recently, like 2 weeks ago, if you're drinking a moderate amount and you have fatty liver disease, that accelerates fibrosis, which is cirrhosis. So it accelerates that process. So really encourage people that have fatty liver disease to try to avoid alcohol at all costs.
But like you said, most people don't even know they've got it.
Right.
Right.
Yeah.
So is it something that I could do, you know, if I come in for my next colonoscopy, I could go ahead and have that scan too? I mean, is it related, or is it like
not necessarily related, but you can get, we can order the fiber scan if you have some of these risk factors, if you have elevated liver enzymes, or you've had imaging for other things and they see fat in the liver, we can get it. Then we're discussing having a cash pay option to be able to, if somebody wants one because they're worried about it, then they can get it. So it's very easy, it's painless, but it replaces liver biopsy. It not only replaces ultrasound for something like this, but liver biopsy, which is basically a controlled stabbing, you know, and you sample like 1/50,000th of a tissue of your liver with a biopsy. This gets a good majority of the liver because it's shooting sound waves, basically, and it measures the vibration that goes through. It's painless, and it takes like 5 or 10 minutes. So it's a very non-invasive way to get a lot of information. Your fat score, which is called the CAP score, and then your fibrosis score.
So let me ask you this: if I came in and I got, if I'm got the risk factors,
Yeah.
say, or even if I don't, and I come in and I get my scan and I've got, you know, fat on the liver or whatever. Is it the same thing? The changes I would need to make then, are they the same as the ones I would need to make to avoid colon cancer? You know what I'm saying? I guess what I'm saying is
Very similar.
yeah. So if for anyone who improves their diet, you know,
Right.
stops processed food, or not stops, but cuts back, some of the other things, you kind of avoid a step, right? If you if you do that, you'll, you know, hopefully improve, and then you wouldn't need the scan.
Right. Yeah. So they're very similar in the sense that you know, obesity and what you're eating contribute to colon cancer, but also to fatty liver disease. But with that, we would kind of counsel you. First off, you can qualify for a couple of medications that are new for fatty liver disease that just came out in the last 6 months or so. One of them is a GLP-1, which is like kind of a semaglutide, and the other one is a different type of medication called resmetirom, which helps get the fat out of the liver. And so you may qualify for one of those two. They'll help for sure. And then we counsel you on your diet, which proper diet would be in like a Mediterranean diet. It's kind of low inflammatory diet. And then counsel you on different foods and things to avoid. Like there's a couple of pitfalls that are like, I call them like wolf in sheep's clothing. Like for instance, low fat foods or fruit juices. Like if you eat eat an orange, let's say, it has fiber with it. Well, the fructose is the main sugar in an orange. You're breaking down that fiber. You're absorbing that fructose slowly, and so your liver can handle it. Fructose is only metabolized in the liver, but it's going so slow that it can do that. But if you drink an orange juice, a class of orange juice, there's like 4 to 6 oranges worth of juice in that, and there's no fiber to break down. So you're like bathing your liver in fructose, which it can't handle. So what happens is there's something called de novo lipogenesis, which is a fancy term for basically it takes that energy, that fructose, and turns into fat and deposits it in your liver. So these are things people think they're doing great by eating, you know, pure or drinking pure fruit juice, and you're actually causing problems. Low fat diet, low fat foods. You know, when you take fat out of the food, it tastes like cardboard. So to fix that, they put like maltodextrin in it, and make it taste better. Well, that spikes your insulin more than regular table sugar. So this will cause fat infiltration. So there's some pitfalls that we don't realize. So if you came in, we would counsel you on those kind of things, and if needed, go to a dietitian. maybe you'd qualify for some medications or something.
Are you seeing, I don't want to put you too much on the spot here, I'm just curious because you mentioned it, but are you seeing an increase with people who are taking Ozempic or, what's the other one?
Wegovy.
Wegovy, yeah, the different one. I know there are different ones. Manjaro, that are, losing weight.
Mm-hmm.
Is it making them healthier? I mean, does losing weight directly correspond with being healthier?
Yes, and with regards to this, for sure. Losing weight. We want a goal. The magic number is 10%. So if somebody came in at 220 pounds, we'd like to get them down to 200 pounds. Mm. And the studies show that losing 10% of your body weight will decrease the inflammation in your liver. So that's kind of the goal that we talk about in the office. But and these medications help tremendously. There's some side effects and some things you may not qualify for. Their cost is sometimes an issue. Mm-hmm. But if you qualify, it certainly will help.
Interesting. So what are some of the, that you know of, some of the side effects? I'm just curious. Anything?
Well, so nausea is a big one.
Mm-hmm.
With you're talking about with
the GLP-1s,
yeah.
And
so nausea is a big one because it slows your emptying of your stomach, and it makes you feel full. That's part of it. That's why you lose weight. That's the biggest one. I have seen pancreatitis, which is irritation of the pancreas, but that's very rare. But and constipation is another one. Nausea and constipation are the biggest ones, and we almost see it almost 100% of the time.
Interesting. No, I only say that because I know there for a while, there, back in the day before GLP-1s, mm-hmm. there were people who were doing the low-carb diet
right.
and different things, and people would lose weight. I know of someone actually who works here, mm-hmm. And they lost a bunch of weight. They got off of their blood pressure medication,
right,
the cholesterol medication,
yes, absolutely.
and it all seemed to correlate with dropping
absolutely.
Some pounds.
It's phenomenal. They work very well, and people, their type 2 diabetes can go away, mm-hmm. blood pressure, all the things, cholesterol, and those all play a role in this fatty liver disease. So.
What do you think about a low carb diet? How do you feel about that?
So the diet we promote is Mediterranean diet, which is not very high in carbohydrates, right. But it'll help. I mean, avoiding carbohydrates helps, but it's one of those diets that, like an Atkins kind of diet, it's one of those that's hard to maintain. But that medication, it helps because you get full sooner. You have this we call early satiety, and you're just not hungry, and that's how you're losing the weight there. But it had just gotten approved last month, Wegovy specifically for fatty liver disease. I'm sure the other ones will follow.
Interesting.
But that'll be helpful in our goal when we say we want to lose 10% of our weight. The studies show, in the upper teens to 20% of your weight you can lose. So it'll be helpful in fighting this epidemic.
So when a drug like Wegovy is approved for treating fatty liver disease, how does that affect your insurance? Your insurance covers it for the most part?
For the most part, it should. Sometimes things lag a little bit. Wegovy just came out with an oral medication, so and I don't know that there's a cash price for that. I don't remember the number, but insurance will lag a little bit, but it should, especially if you qualify based on your fibrosis. The FibroScan score kind of drives that, so you have to get a FibroScan and say, hey, look, they have this. They're at this level, and it's a fibrosis score of F3, I believe, to get Wegovy, but the scan number will help that get covered.
Interesting.
Yeah.
Well, thank you for coming in. Once again, it was something that we had talked about previously and that we wanted to revisit as far as, being an epidemic, fatty liver disease. I think, like you said, a lot of people like me didn't know,
right.
And so it's important to get the word out, and hopefully we did that.
The other thing I wanted to mention is
sure.
black coffee decreases inflammation. There's several studies, one out of Europe and two out of the U.S. 2 to 3 cups of black coffee a day is actually good for the liver. So you can throw a splash of milk in there, but that's another thing that can help mitigate these elevated liver enzymes.
What else you got? Because I hate coffee. Anything else?
So green tea, unsweetened green tea, that's and water. That's basically the 3 things we can drink that aren't bad for us.
Really?
It seems,
Okay. Well, I need to cut back on my diet, Dr. Pepper, then, for sure.
For
So,
sure.
Yeah.
For sure.
Okay, well, Dr. Brent Keller, thanks for coming in again.
Yeah,
It's always
thanks for having me.
interesting conversation.
Yeah.
That's going to do it for us this time on KFVS Streaming, everyone. Thanks for tuning in, and we'll catch you next time.